In this video, I want to be talking about the four main muscles that in my clinical experience, I think contribute to back pain. I want to tell you why these four muscles may cause back pain, how you can identify which one might be the cause of your back pain, but perhaps most importantly, what you can do about it. So thanks for checking out this channel. If you are new here, my name's John. I'm a sports injury therapist and it's great to have you on board. As we make our way through this content, if you are enjoying it, don't be afraid to smash that like button below. And also, if you want to see more, hit that subscribe button. I will be really grateful. But anyway, let's dive into the content and talk through these four main muscles that I think are contributing to back pain. We're going to kick off with number one, and perhaps most locally, which is our Quadratus lumborum. So in order to understand that, I want to talk a little bit of anatomy about our spine. So we have, in our spine, we have our vertebrae, these bony joints that are making our way, forming the spine, and really they're acting as a protection for the main beast, the spinal cord that's running right the way through the middle of that. From that spinal cord comes off all the nerves that go and innervate all of the muscles around our body. We also have our discs living in between those vertebrae, these sort of fluid filled discs, sacs if you like, that are there to really act as shock absorbers in that area and keep all this working nicely. But why is this Q muscle so problematic? Well, the QL, Quadratus lumborum, if we break that down a little bit, Quadratus means that it's a square shaped muscle and lumborum means that it sits in our lower back. So the muscle acts as a square running from the top of our pelvis to our lowest rib. If you imagine the ribs coming off here, we have this square muscle that sits in there. So patients might often say to me that they feel a square-like pain of sensation in their lower back. That is an indicator that we might be leading ourselves towards our QL. But the reason the QL is so important, or so problematic I should say, is that it actually comes and attaches onto each of the vertebrae. So if we develop tightness or dysfunction in that area, what we can get is a lot of pain around that lower back. The other interesting thing about the QL muscle is it has a part to play in our core stability. So we might be familiar with this term of core stability around lower back pain, but our QL is a secondary core stabilizer. It's not our primary core stabilizer, but if they're not working very well, then what happens is we tend to find that the QL gets very overactive, does too much work, and then that creates back pain. So you might be thinking, well, how can I work out if my QL is dysfunctional or tight? Well, the good thing about our QL is on their own, there's two of those muscles either side their spine. When they work together, they create spinal flexion. But we also, when they work on their own, they create side flexion. So we can use that to investigate how well they're moving. So if we get ourselves into a position, it can be on both knees if that's more comfortable, but I tend to like to go onto one knee. And then from that position, if we place our hands above our head, and if my left knee is down and on the bed, on the floor, we then tip off to the side. And we go as far as we can, keeping our chest nice and upright. When we go off to the side, we just see how that feels, how far we can get. And then what we do is we turn around and repeat on the other side. Now, once we get to the other side, if we then find that actually we can't go as far on one side, we get pain on one side, that is a good indicator that actually we might be developing some dysfunction in that side and something we want to address, particularly if when we are checking out the left-hand side by going off to the right, if we know that we have left-hand side lower back pain and we find a tightness, a restriction, a painful element on that left-hand side, then that's a good indicator. So if you found that and you want to know what to do about it, well, we can do a few things here. Firstly, that test that we just did, so taking ourselves off to the side, is a great way to stretch out that muscle. A tricky muscle to stretch because it's deep in its nature, it's deep in its anatomy. But by using our knowledge of its anatomy, that we know that it runs from our pelvis to its lowest rib, if we can pull those two things apart from each other, we know we're going to get that stretch. So by tipping our ribs away, and that's why I stress keeping ourselves nice and upright as possible, and keeping that knee fixed on the floor to fix that pelvis will give you a stretch. If you're feeling very confident and you want an even bigger stretch, what you can start to do is actually bring that knee, underneath your body, find your balance, and then take yourself off to the side. So what I've done there is created a bigger stretch by pulling that pelvis further away from my ribs that I've taken off to the side. So that's one way of getting into that QL muscle. We also, I find something like my trusty lacrosse ball can work really nicely by placing that ball onto our side and working into that area, spending 2 to 5 minutes trying to locate that trigger point, hold on that trigger point, wait for the sensation to die down, and then carry on. A little bit of trigger point release work can be really good. And again, there's other content on my channel where I show in more detail about how to use these lacrosse balls for benefit. And then ultimately, if you're developing that QL dysfunction, it's a good sign that actually something like a core stability program might be really helpful for you. And again, I've got lots of content on my channel around the importance of core stability and how to develop that. So that's the first muscle and the really what I would term most local to that lower back that can be a problem. But let's start to look a little bit further afield. And then again, we're going to move into muscle number 2, which is one of my old favorites, which is those glutes. And in particular, a muscle called your gluteus medius. Now, the glute muscles wrap around our hip, but they actually come into our lower back. And the glutes are made up of multiple muscles, but we also have this muscle that sits on the top, sits just here, sort of above where you might have the back pocket of the jeans, but right at the top of the pelvis there. Now, why is that important? It has a vital role to play in stabilizing our hips. So if we're doing movements like walking or running or jumping or something where we might end up on one leg, in order for my hip not to drop on that side, my gluteus medius has to work. So if I'm doing lots of those activities, I can actually develop some dysfunction in that area. So how do we check out our glutes and establish whether they might be causing ourselves a problem with our back pain? Well, a nice simple thing to do here is what I call the figure 4 test. We lay nice and flat on our back. We make sure that our pelvis is nice and flat and we bend one leg. This is the side that we're not testing. With the side that we are testing, so in this example, my right hand side, I place that foot on top of my thigh. From this position, all I look to do is lift that up. Now, what we should be able to achieve, and now I stress, some people will instantly grab and look to pull. That's what we call a passive test. We want to see the active range of motion. So with this, we just want to lift that leg up. Now, what we should be able to achieve is that this leg can get to 90 degrees because that's being allowed by that right-hand side. If I go to lift and my right-hand side kicks in very quickly and I can't get to that 90 degrees position, that's an indicator that we're tight in that area. So what can we do about that? Well, again, in a similar way, we can, as the QL, this test can be a great stretch. So we can go into this position and stretch that muscle for 30 seconds. This time, when we're stretching, we can look to add a bit of passive pressure to make that stretch a deeper one, but we shouldn't be creating pain. We don't want to make this a discomfort. We just want to feel that gentle stretch. And now with the stretching, you can do that 2 or 3 times, and you'll find that that might start to ease out that area. We can also use the ball. Another area that I think the ball works particularly well for is getting into our gluteus medius by simply sitting onto the ball, and then with a bit of practice you get better with this. But what I like to do is take myself into a position where the ball, I can feel it in either the top, the middle, the bottom of my glutes, and I start by facing square, but then I roll myself off to a 45-degree position. And what that's done there is taken the ball through the path of the glutes, and I can start to identify if I get a change in sensation. If I get that change in sensation, then that's somewhere where I know might be a trigger point, and I'll just spend some time working into that area and seeing if I can loosen that out and break out any dysfunction. But another thing that I find to be really helpful when we're working into our glute area, or testing our glute area, is seeing how well it recruits. I see lots of powerful guys and girls who might be big weightlifters who can squat lots of weight, but when we try some of these simple tests at how they recruit these glute muscles, they find a lot of discomfort in that area. We have to remember that the body is incredibly good at achieving our goals, and if it hasn't got the right makeup to do it, it will compensate in order to achieve that. And it's a common compensation pattern that we get these underactive glutes. So how can you tell if your glutes are underactive? Well, what we look to do here is we get ourselves onto a position where we're on our hands and knees, and what we could look to do is take this leg out to the side. Now we're looking for 2 things here. We're looking firstly for how much movement can we get into this rotation of the hip. Do I find that very difficult? Does that bring on pain in the hip? That might be telling me that I'm underactive or not strong enough in that area. But one of the big things that I want to do is look to go through 3 sets of 12, and I'm really trying to understand that fatigue. Now, as I'm working through this area, I can really feel that working into here. And what I find with a lot of patients is they might not be able to make one set of 12. They might feel really fatigued. And the key here is comparing the good side to the bad side. Start off with the good side, see how you find that, and then do you get that same level of fatigue on the bad side? If there's a big discrepancy between the two, that's something we need to work on, and you can use that exercise to improve your glutes. There's multiple exercises that we can be working on to improve that glute strength and recruitment patterns, but that's a nice one there to help with that. The third muscle that I wanted to talk through is our hamstrings. Now, why are these a problem? Well, the hamstrings come up, we've got 3 of those hamstring muscles, and they come up and they attach into the back of the pelvis here, something called our ischial tuberosity. Now, if that muscle that's coming down here becomes short and tight, what it can do is actually pull that pelvis backwards. Why is that a problem? Well, that creates some pressure in that lower back. We want our pelvis to be able to remain nice and neutral at all times, but this backward tilt at the pelvis causes a closing up of that lumbar spine and pressure in that area. So we definitely don't want tight hamstring. Big cause of lower back pain. So how can we identify this? Well, we can look at something like a straight leg raise. And what we should be looking to do here is lying nice and flat, keeping our hips flat on the bed. And what we want to do is look to lift our leg up to straight. Now, a few key things to happen here. We want to get to around 90 degrees, which I haven't quite got, a little bit tight in those hamstrings. Compensation patterns that tend to happen. The first one that we'll see is that people will bend that leg to get a little bit further. Take that hamstring off of stretch to achieve a little bit more. You have to keep your leg straight. The second thing is that they'll ride up on the other side. That's another classic compensation pattern. By just lifting that pelvis, I can get a lot further. But that would be a cheating compensation pattern. So make sure when you're testing this that you're keeping your hips nice and flat on the bed. If you find, particularly again, that sore side, the painful side has a tighter hamstring, that's a good indicator that you might want to be addressing that area by taking this, something like this as a stretch, holding it for 30 seconds, 2 or 3 times a day in order to take some of the pressure away from that lower back. My fourth and final muscle, and again, I've put together videos around this topic because it's quite a big topic because I believe it's so forgotten, is our hip flexor muscles. Now, hip flexor muscles, they live on the front of our pelvis. So people often say to me, well, when you're working on the front, when I've come to you for back pain, what's the link there? Why are we addressing the front for something that's wrong with my back? Well, the key thing, yes, the hip flexor muscles do cross the front of the hips, but they actually come up and attach directly onto the lumbar vertebrae. So if those muscles are getting tight, they're going to be pulling and creating force on those lumbar vertebrae. So it's often missed. We often attack this back area because that's where the pain is, but actually we're missing the fact that these muscles are coming from the front and attaching onto that area. So a couple of ways that we can look to address this. Now, this test, I've left it till last, but actually it's a nice way of really picking out any dysfunctions around the hip. We call this the Faber's test. It's similar to the figure 4 that we did earlier because we get ourselves into this figure 4 position. So my foot just comes up and onto my thigh. Now, the key here is that we're looking to drop that leg down towards the bed, and we want to get that nice and flat. Now, bit of a live example here. I'm quite tight through my left hip. It's an imbalance that I know I have. And what happens here for me is why I like this test is it really highlights our areas of dysfunction. I feel a restriction in my hip flexor and I feel a restriction in my groin. Other people might feel a problem around their glutes, but it's a way of really finding out what might be the most problematic area for you to address. Now, if we have a look at my other side, that just feels so much easier for me. I can get it so much flatter doing the same test. I feel absolutely no restriction anywhere. Maybe now I'm right down to flat, a tiny pull in my glutes. But if I come back to this one, I just don't go as far. My hip flexors and my groins kick in and I can feel that preventing me getting further. So I know that as part of my rehab, addressing those hip flexors and groins and seeing if I can get that leg flatter is going to be more helpful for me. And I know that that tight hip flexor could certainly leave myself predisposed to some back pain. So what do we do about those hip flexors? Well, again, a nice way to stretch these is that we can get onto our knees and place our foot out in front of us. Now, What we can look to do, the most sort of aggressive form of this stretch, is to bend our knee forwards and tip our pelvis backwards. And my hands can carry on to go above my chest to tip me right the way back and look to open up this hip area. That's a really kind of nice way of stretching that out. But if you're someone who's suffering with lower back pain, that kind of back extension might be something that we want to avoid. So you could just do the stretch from here without tipping back, or also by really just trying to work that pelvis. So difficult to show, but what I'm looking to do here is tip forwards and contract my glutes. And what you should feel with a squeeze on the glutes and a tip forwards is a pull right the way through the front there. You can just hold that for 30 seconds, relax and repeat 2 to 3 times. And that will be starting to loosen out that hip flexor. And what that will be allowing us to do is take some of the pressure away from that lumbar spine. So I hope that's been helpful for you. So there's multiple ways that we can have back dysfunction and back pain. But what I wanted to do is address the 4 main muscles that I see in clinic, how we might be testing people to give us some indications about some of the things that are going on and some clues to what might be the problem. And then once we work out what's wrong, how we can get about tackling that pain. If you've made it this far in the video, firstly, I'm super grateful. Secondly, I will be even more grateful if you hit that like button so others can see this video. And if you like this content and you want to see more from me, I promise I'm going to keep bringing out videos as we have done now for a long period of time, and we'll carry on for a long time in the future. So make sure you hit that subscribe button, hit the bell notification, and then you'll be the first to see my next video as soon as it drops here. See you on that one.